2 years ago today, I shared the news that we had our first officially confirmed case of COVID-19 in Alberta, and that we had a total of 4 presumptive cases. At that time, we had no vaccines, we had no antivirals, and we still had much to learn about the virus. We have come a very long way since then. What we've seen over the past 2 years is extraordinary. The speed of identification and sharing of new information on this virus has been without precedent. Along with others around the globe, we have continually used the latest research and findings to translate into best practices. We no longer need to respond to COVID as the biggest health threat we collectively face, and yet we still need to mitigate its direct impacts. This might seem contradictory, and this is part of why finding our way forward is so hard. We need to be able to hold 2 realities at the same time. One is that COVID is still a threat to take seriously, and the other is that the COVID population risk has been reduced, and we can move to seeing COVID as one risk among many, one we cannot fully eliminate, but that we can manage.
New daily admissions have dropped almost every day for over a month since they peaked on February 7th. All this data, combined with high levels of vaccine protection in Alberta, confirms that it was the right time to transition our response to COVID-19. Over the course of the last few weeks, we have slowly returned to a more normal way of life as Omicron transmission has decreased and the pressure on our health system has eased. But as we ease restrictions and move forward together, we cannot ignore the strain that COVID-19 has placed on our healthcare system. We must build our system capacity to ensure that Albertans continue to get the high-quality care they need and that they deserve. That's why we're investing $300 million over 3 years to add ICU capacity. Today, I have directed AHS to rescind its immunization of workers for COVID-19 policy effective March 10th at 4 p.m. This directive covers employees of AHS, its subsidiaries and Covenant Health employees, members of the medical and midwifery staff, students and instructors, volunteers, and applicable contracted service providers, including those working on AHS sites and separate providers under contract. This change is in line with policies in other jurisdictions, including Manitoba and Quebec. As of 4 p.m. tomorrow, AHS will no longer require currently unvaccinated employees to do mandatory rapid testing. Employees on a leave of absence due to immunization status should work with their managers to determine their return date.